Nothing you're about to hear should be taken as or used in place of medical advice. If you resemble anything you hear, contact your doctor. If you want to know what Walgreens thinks, ask them, because we don't know. Please wait behind the line for privacy.
You're listening to the Pharmacist Answers podcast. I'm Cynthia, the pharmacist, and today you'll get your questions answered and your curiosity cured. One of the things that's been a big theme in some of the conversations I've had in person and on Periscope and watching other people's Periscope is collaboration. If anybody's a fan of Ronei Harden, she does Coffee Talk, and she's been talking about the generational differences and the generation that I kind of fall into, and then those a little bit younger than me, as we're getting into adulthood and starting to adult and make decisions for ourselves and form opinions about things in the real world, how they differ and how we differ from a generation just previous to us. And one of the things that she points out over and over again is that our generation likes the concept of collaboration, where we're working together and wrestling our ideas together and kind of disagreeing, but being able to work out and become better in the end, versus the generations before us where the boss said and you did, or the president said and you did, or the doctor said and you did. Now we're kind of getting into this generation where we're asking questions. They're like, okay, you want me to do that, but why? Explain to me why. What is that for? Why is that a good idea? Why should I believe you in telling me this? And so the concept of collaboration in our careers is something that has been widely accepted in a lot of fronts. But healthcare and medicine seem to be the place that is so resistant to the concept of collaboration. And one of the reasons is that doctors and some older school pharmacists have this elitist mentality that I went to school and I got all of this degree and I've been deemed the expert in this area, so therefore I'm the expert, you listen to what I say and you just do it and everything will be fine. But the thing that they fail to realize, and the thing that we're starting to realize more now, is that doctors are human just like we're human, and pharmacists are human just like we're human, and humans are imperfect, and humans make mistakes just like any other human's going to make mistakes. So going into a relationship with a medical professional to say, you may be the expert on the medicine that the textbook taught you, but I'm an expert on me and how I feel on the inside and how I think in my brain and the things that I value and the things that I have an opinion on and the things that are important to me. And so going into a health relationship with the idea that we're going to collaborate about my health. I'm going to collaborate with my doctor and work together to come up with the best treatment, the best solution, and make the best decision for how I'm going to be treated, how things that are going to be done to me to help me get better, or whatever it is that you're suffering with, whether it's an acute condition like an infection or an injury or something like that, or something that's more chronic like diabetes or thyroid conditions or those other kind of autoimmune things that are just chronic and just stick with you your whole life. Being able to go into a relationship with a new doctor, because sometimes people have to change doctors, or if it's a doctor you've had for a long time, and just saying, hey, this is how I want our interactions to go. Being completely upfront with that and saying, this is how I expect to be treated as a human and as a person, and not being overly aggressive and demanding, because they command respect just like you command respect, and we're all going to be respectful and gracious and forgiving when minor mistakes are made and things like that. But being able to say confidently, this is how I want our relationship to progress as you are the medical expert taking care of me. We're going to work together. I want to be respected and actually treated like I'm an educated person and not like I'm dumb, because that's one of the things that I see doctors do. And I've kind of experienced it myself when I've encountered a healthcare professional that may not know me. My personal example is I've had 2 children, and both children were delivered by midwives. And the midwives I've had, I've always gone in and say, you know what? I kind of know how I got in this position, and so I don't need everything dumbed down. I am a pharmacist. I have a little bit of education for the things that we're going to be talking about. So you feel free to use the big words, because I'm probably going to understand them. If we get into something that's super specialized that I may be kind of rusty in or may not exactly remember, then I'll ask and we'll be able to work it out. Medical professionals sometimes have a hard time using plain English. And so I wanted them to know that if you forget to use the plain English, it's okay. Just relax, because I'm probably going to understand, and you don't have to work so hard to help me understand what you're talking about. And from that conversation on, they had so much more relaxation in their interactions with me. It became very lighthearted when I saw them. It became very friendly when I saw them versus so professional. So then one time when one of their overseeing doctors had to see me for something just because the staffing was short, and they were like, this is just a quick checkup. So she popped in and she kind of routed off all these doctor things to me. And I was like, whoa, hey, I'm not like a 16-year-old girl pregnant. Like, I'm an educated woman that knows what you're talking about. So it's like, it was very abrasive. But she wasn't my regular doctor, and I wasn't going to like get into a whole thing and like act all offended. But it was just the difference in the interaction of somebody who knew me, and we were actually collaborating together on my health and making decisions that I was comfortable with during my pregnancy to make it go as best way as I wanted. But then them also knowing that once I left there, I was going to be well taken care of, and I was going to know like what I needed to do next. The two faces of that coin were very, very different, and it stuck out to me. Being pregnant is the most recent experience I've had with doctors, because I hadn't had needed other doctors lately. But I have that same relationship with my children's pediatrician. He knows I'm a pharmacist. He still has to do his doctor thing because they're kids, and they can't necessarily tell him what's wrong, and I can only tell him what I observe versus knowing how they're feeling on the inside, because they're kids and they don't really communicate those kinds of things. So that's a little bit different, but he still has I can see the persona on him of him having a greater sense of ease, being able to communicate things to me, and that I'm going to understand what he's talking about, and I'm going to understand the seriousness or the not so seriousness of what's going on. Whether it's just a checkup or like the situation we had where my daughter got dehydrated and we knew it was serious, and he was doing everything in his power to make sure we didn't have to end up at the hospital. And so that type of collaboration of him understanding the seriousness of the situation and us understanding it and being on the same page, we were able to work together, keep her treated outside of the hospital so we didn't have to take the little baby to the hospital. And so that's the kind of relationship that I appreciate, and that's the kind of relationship that I know people will thrive in if you have the confidence inside to say, you know what, I have the right to command respect, and I have the right to disagree with my doctor and have that adult conversation. If the doctor isn't willing to be as big of an adult back to you and gets all offended and says, well, if you're not going to do what I say, then you need to find a different doctor, well, great. There's you a door. Find you a different doctor, and find one that you can collaborate with and have a good relationship with that open communication. Because I believe you're smart. People are smart. You have brains in your head. You can learn things, and hopefully I can help you learn some things that can be more complicated, or at least guide you in the direction to say, if your throat hurts, please don't Google it, because Google will probably tell you you have some type of cancer and think you're going to die, when that's probably not the thing that's wrong with you. But using your brain, and you can learn things mostly about yourself, and then you can learn things about conditions that you may be dealing with, so then you can be better prepared for the options the doctor may give you for y'all to make the best decision for you, because what you value in your health may be different than what I value in my health, and what you're willing to do for your health may be different than what I'm willing to do when it comes to the options that the doctor provides for different types of treatment. So that's my one big tip for today, is when you go into health relationships, be open about what you want from that relationship, and saying, I don't want to just be a yes man and do everything the doctor tells me. I actually want to be treated like an educated human, that we're going to collaborate and work together and come up with the best option, not just the doctor thinking that they know the best every single situation, because sometimes they may not. And again, you're not in a textbook. They're not going to find you in a textbook. You as a person are completely different than the next person that they're going to see, even if the condition that you're dealing with and they're treating you for is the same. So anyway, that's my word of encouragement. Y'all have a good day. Bye! Thanks for listening to the Pharmacist Answers podcast. The pharmacy is now closed. You can post your questions and comments on our Facebook page. That's facebook.com/pharmanswerspod. Or you can email the show at pharmacistanswershere@gmail.com. You can tweet me or message me on Twitter at @SinHendrix. You can find the show notes at pharmacistanswershere.wordpress.com. Pharmacist Answers broadcasts live on Monday, Wednesday, and Thursday at 9:02 a.m. Eastern Time on the Periscope app. You can follow me at SinHendrix or view in your web browser at periscope.tv/SinHendrix. See you next time on the Pharmacist Answers podcast.